About 2 million adults in Africa die prematurely from the complications of diabetes and hypertension. These conditions are affecting adults at a younger age than is the case in high-income countries. Only a small fraction of people living with diabetes or hypertension are estimated to be in regular care in Africa. HIV-associated mortality has declined from over 2 million a year just over a decade ago to less than 500,000 a year today, but the numbers dying from diabetes and hypertension are rising. Hypertension and diabetes programs will need to achieve similar levels of retention and disease control as HIV control programs have done in order to meet the Sustainable Development Goals. In Uganda, like elsewhere in Africa, infectious diseases were responsible for the vast majority of deaths of adults as late as the early 2000s. Today, the World Health Organization estimates that 1 in 3 deaths is attributed to non-communicable diseases, and in the next decade or so, deaths from these diseases will be higher than those from all infectious diseases combined.
The burden of non-communicable diseases is on the increase, and this is evidenced from our information that comes from our health facilities. But also we did a study in 2014 where we found that the prevalence of hypertension, for example, in adults is 24.3%. That means almost 1 in 4 adults has increased blood pressure. 1.4% has diabetes, and when you come to urban centers, 3% of adult population have diabetes.
The onset of the HIV epidemic in the 1980s and the subsequent years had a devastating impact on the country's health system. HIV infection rose sharply, with about 1 in 4 adults affected. In the 1990s, Uganda put up a robust HIV response which rolled back HIV prevalence to the current prevalence of 5 to 7%, a success that was exemplary and applauded globally. In the course of responding to HIV, the country has built an elaborate infrastructure which can be tapped into to provide treatment to the increasing number of people impacted by non-communicable diseases. The AIDS support organization TASO, the pioneer organization, grew out of giving counseling and support when no treatments were available. Today, it continues to provide those and provides treatment for HIV infection.
When you look at what we have in terms of the system that we have created in supporting individuals and families that are living with HIV, there is a big opportunity for non-communicable diseases. First of all, the person has the opportunity to get information, because the information is power. But information in a sensitive environment, information which is provided in a counseling environment, and it is HIV that has given us the opportunity to develop counseling.
TASO is working in partnership with Liverpool School of Tropical Medicine, the Medical Research Council under the Uganda Virus Research Institute, London School of Hygiene and Tropical Medicine, Tanzania National Institute for Medical Research, and Hundu Mandal Hospital in Tanzania to conduct a study on how to organize chronic care for persons living with HIV and non-communicable diseases, particularly diabetes and hypertension. The study is done in collaboration with the Ministries of Health of both countries. TASO is one of the 32 sites in Uganda and Tanzania taking part in the Inter-Africa Research Study to test the feasibility of integrating care for diabetes, hypertension and HIV in primary healthcare facilities in Uganda and Tanzania. 53-year-old Mustafa Kayondo has been living with diabetes for 25 years, having been diagnosed with the condition in 1995.
kale omubiri gwange teguli bulungi nga nina ebbugu mulingi n'ebigere byenyini nga mpulira bivaamu omuliro eri wansi ng'omuliro gunjokya nnyo nembeera mu mbeera efaanagana ng'eyo appetite nga muyina oluusi n'abula nabeerako mu bulamu bwe nga nina kiraana zokka kati oluvannyuma lw'okubeera ne kiraana nga ngenda ninyisa kiro nentandika okufuna ebyo ebizibu ebyo mutwe gunnuma nkalambala mu kamu eno nenfuna embeera etali nnungi naye era sitiro ne bitantwala mu ddwaliro.
30-year-old Josephine Biyinzika was diagnosed with diabetes in 2017.
I didn't know exactly that I had diabetes, but I just found out that I was sick, falling sick off and on. They are treating me in the clinics. They are finding out that I don't have any disease. But after some time, a doctor said, this one has signs of diabetes. Let's check for diabetes in the clinic. So when they checked for diabetes, they found out that I was diabetic. The condition was worse, and by that time, I was almost going into a coma.
63-year-old Prosi Naruboa has been living with HIV for more than 20 years. She was one of the few people to be started on ARVs as early as 2001, before they were widely available in Uganda. She was diagnosed with hypertension 2 years ago when she suddenly became unconscious and got a stroke at her mother's burial.
Baba bamuteekayo n'entunulayo bwenti saamanya kyankuba n'engwa nga wali amagezi ne ganzigwamu ne bansitula ne bawujja ne banteeka mu mmotoka ne banziza e Kampala ngenda okutuuka wano ne banteeka mu kilinika awo nzira engulu mbuuza nabadde ki ne bagamba pressure.
Josephine, Mustafa and Prosi from Tasso are from one of the 10 sites in Uganda and Tanzania taking part in the MOCA research study on integration of care and treatment to counter the burden of non-communicable diseases.
I am very excited that Tasso today took up leadership in conducting operational research to learn what does it mean to integrate care for non-communicable diseases with existing system that supports a person to live positively with HIV. And I think the research that has been conducted will give us very critical lessons. And I'm very excited because I am a member, I am actually a participant in this research. And not as a founder of Tasso, but as a patient.
For the participants living with diabetes and hypertension, being part of the study gives them an opportunity to be assessed for any hidden conditions other than those related to HIV and to access some medication and support. But some patients decry the high cost of treatment for non-communicable diseases, which is currently out of reach for many Ugandans.
Singa batuyamba madamu ne mutuyamba ku kintu ekiyitibwa obujjanjabi bwa ssukaali diabetes. Oba oli emmere tuyinza n'okwenoonyeza kale naye eddagala era ekibatujjako ekireeta ffe tufe kwegamba eddagala lirya buseere nnyo.
Tasso clinics are well known as daily outpatient facilities for care and treatment for people living with HIV. Accessing services from here, patients with non-communicable diseases who are not HIV positive have to overcome the HIV-related stigma.
The people I live with, almost all of them are HIV positive. So when I found out that I was diabetic, I said for them the HIV positive, me I'm diabetic. So we are to live together and we are to help each other. So being in the environment, or getting my treatment from the environment which is not of my status, it does not affect me at all.
Omulwadde wa siriimu n'owa sukaali gwe bw'oba olaba njawulo ki nze mbeera ne sukaali wange obulamu bwe bwonna ate nno ky'otannaba kumanya nze nina ne be baŋŋaana okulya nina condition ze ntambulirako owa siriimu alya buli kyayagala kyonna n'akisaawa ate eddagala n'afuna lya bwereere kwegamba mu bumpimpi osanga ate owa siriimu fe ate atosingako.
A pilot study in 10 facilities in Uganda and Tanzania showed that it is feasible and acceptable to integrate care for patients living with any one or more of the 3 conditions: HIV, diabetes, and hypertension. Analysis of costs showed that integration of services reduced both health service cost and household costs and could be an efficient way of increasing coverage of services for diabetes and hypertension.
Preliminary interactions with the community shows this is very, very welcome, because people have to travel long distances sometimes to pick their supplies for diabetes or hypertension, or they have to spend so much money to get it. You travel long distance, then again you have to go and pay. So interventions that take these services hopefully into the community will be welcome.
The research group has been so far successful with the pilot study, therefore undertaking the next stage will consolidate their work. They have built partnership between researchers, government policy makers and patient representatives who will lead the research towards interventions that prevent multi-morbidity. Integrating HIV care with non-communicable diseases appears to be viable and a much-needed approach.
So we think it's the way to go, to integrate, and I think some studies have proved that integrating non-communicable diseases into HIV care is cheap, is possible, is acceptable, and is the way to go. So I think I would be interested in more research in that direction so that it informs policy.